The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. It is Sunday, June the 7th, 2026. Welcome to This Week with Mary Holland, President and CEO of Children's Health Defense, and myself, Polly Tomei. Good morning, Mary.
Good morning.
All right, first article, Suzanne Burdick in The Defender. COVID vaccines and cancer, doctors and scientists to testify at upcoming Senate hearing. They will testify about the plausible mechanisms of COVID-19 injections causing cancer and attacks on scientific publications during a hearing hosted by Senator Ron Johnson, chair of the Permanent Subcommittee on Investigations. The witnesses will discuss the biological mechanisms by which COVID-19 vaccines may increase cancer risks and resistance by some scientists and health officials to acknowledge such discoveries. And we should just do the next article with Suzanne Burdick, Senator Ron Johnson. There used to be serious journalism on vaccine injuries, but COVID vaccine cancer risks still are being suppressed. So, Mary, what an event that was.
That was fantastic, Polly. Senator Ron Johnson has held several hearings, but in a way, I think this one may have been the most important. I don't think it's gotten the mainstream media attention that it deserves. But these were, Polly, really, really mainstream doctors, or they had been mainstream until they said things that the mainstream narrative didn't like as Dr. Dalgleish said, the safety signal is screaming that these shots cause cancer. And the more shots you got, the more likely you were to get cancer. So Sabine Hazen, whom we've worked with, she said that her papers relating to the risk of the COVID shots have been retracted with no explanation. Dr. Eldery, who headed the cancer program at Brown University just a couple days ago in June, put something out on LinkedIn linking to a paper of the mechanisms whereby these shots can plausibly cause cancer, and they censored him. His article in Onco Target, a mainstream cancer journal, is being censored. It's really Dr. Malhotra also testified. So he was a kind of celebrity doctor in the UK. They're now considering taking away his license because he said he thought that very possibly the royal family's cancers related to the COVID shots. And there's been a letter signed by 150 doctors to oppose that. But the mainstream does not want the narrative out there that if you took the COVID jabs, you're at a heightened risk for cancer, which is the truth. And, as Senator Johnson said, there used to be, before pharma owned mainstream media since 1997, they have been able to advertise on television. Only two countries permit that, the US and New Zealand. New Zealand, 4 million people altogether, and a lot more restrictions than here. There's no serious journalism about vaccine injuries and vaccine risks. And Senator Blumenthal, the ranking member, pointed to a sentence on the National Cancer Institute website under NIH saying, there's no risk for cancer. But one of the interesting things, Polly, was the witness that Senator Blumenthal put up to say there's no problem here. Dr. Graylow from ASCO, from the Clinical Organization for Cancer Research, she ended up kind of walking back where she started, that, there's nothing to see here. And she ended up with, there's no evidence proving that mRNA causes cancer. Well, that wasn't the purpose of the hearing. The purpose of the hearing was, what are the plausible mechanisms? So I hope that gets some coverage, Polly, but kudos to Senator Johnson and to all the people who testified. We've got to keep telling the truth.
Yes, we do. Well, staying with Senator Ron Johnson, his staff are asking, do you have a COVID hospital story? Here's how to submit it to the congressional record. This is Senator Ron Johnson, chair of the Senate Committee on Homeland Security and Governmental Affairs. He's agreed to open the congressional record on COVID-19 hospital protocols. It's a step-by-step guide here included in the show notes. Now, I know this is, by the way, open to anyone, patients, family members, healthcare workers. But we know, Mary, at Children's Health Defense, how many of you there are out there and how many have written to us asking, have you forgotten about us? And we never forgot about you. And I'm so pleased that Senator Ron Johnson is doing this because it's about time. So do submit those stories in. It's very important.
Absolutely. Absolutely. Please.
Michael Novodakis here in The Defender. Trump signs executive order backing HHS on childhood vaccine reform. Will it even matter? The order directs public health agencies to align the schedule with an HHS federal assessment published in January that calls for fewer recommended childhood vaccines. Some experts suggested the order is intended to override an April court ruling that paused recent changes, including a reduction in the number of diseases covered by the schedule. The American Academy of Pediatrics said it will challenge the order. Of course it will, Mary. Of course they will.
It will. Well, I was really happy to see this, Polly. This came out late last Friday, a Friday before this one. And it really basically punches back, right, against sort of what's been the public narrative. It punches back against this AAP lawsuit with other infectious disease and public health organizations. And it says, you know, what I said as President Trump in January in my presidential memorandum, I'm standing by. We should be aligned with what other developed countries are doing in vaccines. We shouldn't be way beyond that. So this just basically reiterates what the presidential memorandum said. You know, we're not going to walk back on the ACIP committee. We're not going to walk back on our recommendations to reduce the schedule from 17 to 11. We're not going to walk back on saying you shouldn't have a birth dose of Hep B. You shouldn't give the MMRV until after age 4. Some people, including Daniel O'Connor of Trial Site News, pointed out that it also seems to say parents get to decide. It is not up to the state. It's not up to the federal government. So it's definitely good news. I don't think we really know ultimately, Polly, what it's going to mean, but it's very good news that all of this sort of hubbub of like, you know, President Trump has abandoned, Bobby Kennedy abandoned the vaccine issue. That's obviously not true. And that's great news.
Okay, well, Trial Site News here. Robert F. Kennedy Jr. must investigate. Regulators told the public that mRNA COVID vaccines say in the arm, but the evidence said otherwise. By the time the COVID-19 mRNA vaccines rolled out, regulators were already reviewing data that didn't support what they were telling the public, that the vaccine stayed in the arm and disappeared in a day or two. This raises serious questions about regulatory conduct, informed consent, negligent misrepresentation, potential suppression, or minimization of material safety information, and whether civil or criminal liability could emerge if the courts prove intentional deception or knowing concealment.
Polly, this is a really good point brought by Daniel O'Connor at Trial Site News. So naked mRNA, real messenger RNA from the human body, is very, very fragile. And so if you were to inject it into a petri dish or into a human, it will disintegrate very quickly. It will die. It will not be sort of stable. But that's not what was in the COVID shots. What was in the COVID shots were modified mRNA packaged in lipid nanoparticles. And so what O'Connor is pointing out is that the scientific community 15 years ago said, no, mRNA, modified mRNA, so artificial mRNA in a lipid nanoparticle is not going to disintegrate at the site of the arm. It's going to travel around the body. It's going to be in the liver in 1 to 4 days. So I think O'Connor raises a really important question. Was this intentional fraud? Was this intentional deception? And it really goes not just to the COVID shots, but it goes to the integrity of modern medicine and modern science. Like, can you trust anything that's coming out of these institutions? So I think it's a really good question. There was this ridiculous, to my mind, Polly, ridiculous idea of like, oh, you're going to inject it in the arm and it's not going to travel. No, the whole point of an injection is it's going to go through the whole circulatory system. There was something so nutty about the whole proposition that, oh, the mRNA is just going to disintegrate at the injection site. I think it's an interesting question. It should be looked into.
Okay, Jill Erzin here. Critics question $60 million push for Ebola vaccines built on COVID-era platforms. A global vaccine coalition announced more than $60 million in funding for experimental Ebola vaccines built on technologies using during the COVID-19 pandemic. As developers emphasize speed, critics, including John Campbell and children's health events scientists, say key safety questions about these platforms remain unresolved. And staying on Ebola, the BBC News reporting that 3 Ebola vaccines are in development amid growing outbreak fears. Typical BBC reporting there. The International AIDS Vaccine Initiative is working on 1 vaccine, and they said the outbreak is threatening to be the worst ever. The University of Oxford and Moderna are also researching vaccines. So this is more fear mongering. Also, Russia, by the way, is developing a vaccine against the new Ebola strain as well.
So as Karl Jablonowski says, these are going to be shots in the dark. They're putting speed ahead of safety. Basically, this mRNA that Moderna is going to develop is the same basic model as for COVID shots. So basically, they're just like they use the spike protein, they're using part of the toxic part of Ebola to develop the vaccine so that your body produces the antigen and then you react against it. So literally, from my perspective, layperson, but you're causing an autoimmune disorder, right? You're having your own body manufacture the bad stuff so that your body can react to it with the good stuff. It doesn't make a lot of sense to me. But anyway, 60 million is going to CEPI. 50 million of that's going to go to Moderna. Gavi is giving 50 million to Moderna. The World Bank is putting 220 million into these Ebola vaccines. So this is for the Budibungyo strain, which is now allegedly, spreading from the Democratic Republic of Congo and Uganda. They already have a vaccine for the more common Ebola strain. I mean, Polly, this is so, why aren't we looking at things like ivermectin and hydroxychloroquine and repurposed drugs? And we know that Ebola is only transmitted through bodily fluids, right? This is through like saliva, it's through bodily fluids. It can be like if you're washing at a burial. This is not respiratory. This does not get transmitted in the ways that COVID, could be transmitted. So the whole thing is bizarre and something we have to watch.
Yeah, I'm not sure anyone's buying it anyway. Well, our lot are definitely not buying it.
Our lot are not buying it, but it's tragic. Polly, think of what we could do with $400 million. Seriously, think of what we could do with $400 million. I mean, it's egregious that money is being poured into these things that you and I both know are going to harm people. They're not going to be safe. How could they be safe? They're making the vaccines. It's just like COVID. We've come up with the in silico. We've come up with the sequence, and so we're going to make it on a computer and we're going to pump it into people's arms. It's horrifying.
Okay, Henrik Kaulisen in The Defender, let that sink in. The feds charged 2 NIH researchers with smuggling Mpox into the US. So these 2 NIH researchers are charged with conspiring to smuggle biological materials, including the activated monkeypox virus samples, into the US from Africa. The researchers work at a biosafety level 4 laboratory in Montana. The charges have renewed scrutiny of safety procedures for handling potentially dangerous pathogens. I mean, you can't make it up, Mary.
I was just going to say, you can't make it up, Polly. You can't make it up. So here are these 2 people who work at the Rocky Mountain Labs in Montana that already have a terrible safety record, right? So they were hauled up, they were arrested at the Detroit airport. Interestingly, neither one of them are US citizens. One is a citizen of Cameroon, the other is a citizen of the Netherlands. And they're being charged with conspiracy to smuggle and false statements to federal agents, and they are facing up to 5 years in prison each. And interestingly, the senior guy, Munster from the Netherlands, he's a co-author with Peter Daszak on some of the COVID stuff. So, this is another really interesting prosecution. I hope that this goes forward. I hope that Dr. Munster has a lot to say for himself. But can you imagine? I mean, obviously, this isn't the first time that they, in my best guess is, if they felt like they could do this and bring in over 100 samples of Mpox, this would seem to be something that they do rather routinely. I mean, it's shocking.
Okay, Lioness of Judah Ministry here. Ed Dowd, we've added another 3 million disabled since COVID vaccine rollout. This is former BlackRock fund manager saying disability numbers continue climbing while excess deaths remain above normal. This brings a total rise since the pandemic era to roughly 6 million.
It's terrible. So Ed Dowd is a really important analyst. You know, he is very familiar with statistics and how to read these things. And to me, what's most important about this, and the book that we published that he did, Polly, Cause Unknown, is that the excess death rate is 5% above normal for the last many, many decades, and the disability rate is 5% above normal. The correspondence of those two numbers, excess deaths, excess disability, strongly, strongly, strongly suggests that that's due to the COVID shots. Thank you for doing that, Ed, and to Lioness for Judah for pushing this out and making us aware of it. What happened, it was criminal, and we have to help other people that still don't understand this recognize it so that we can not do this again. COVID resolution, covidjustice.org. Go sign it if you haven't. covidjustice.org. It's just a resolution for the Senate to say what we did during COVID was wrong. It harmed people, and we're not going to do it again. That's the most important thing, right? It's important to look back. We'd like to have some kind of real reckoning, but the most important thing is let us not fall down the same trap like they're talking about with Ebola or like they're talking about with Ebola, Mpox, etc.
Okay, well, secret trial of Pfizer's RSV vaccine killed 2 infants in the 1960s. Their families have just sued the US government. So this is the families of 2 Black infants who died. Alleged researchers enrolled the children without parental knowledge or consent. The suit also claims tissue samples from the deceased babies later contributed to the development of RSV vaccines. That's awful, Mary.
This is explosive, right? So these are siblings of 2 African-American baby boys, 2 months and 4 months, who were enrolled in a National Institute of Health scientific experiment to create RSV vaccines that are now on the market that are also injuring children now. So these two infant boys were given these shots after they had been experimented on 4 mice, 4 guinea pigs, and 25 monkeys. And then they thought they were good to go. This is Pfizer with NIH. These babies were continued to be given they were given 3 doses of this RSV vaccine while they were developing severe lung infections. These were the youngest babies in this clinical trial. The family had no idea that these babies had been enrolled in this clinical trial until kudos to a journalist with Undark, who in 2023 contacted the family. Polly, this is really exactly the same issue as happened to the African-American woman, Henrietta Lacks. There's this really important book, The Immortal Life of Henrietta Lacks. And they used her cervical cancer cells to create HeLa cells that have been used in science all around the world without her consent, without her knowledge, without the family's consent to use this. So I'm so grateful again to the lawyers who are representing these families. And I hope that this story, we will continue to follow this, because that's an outrageous story. It's an outrageous story. It's outrageous that doctors so regularly, Polly, put science, so-called, above human life. It's just, we've got to expose this. So
KFF Health News. RFK Jr. pushes for access to Americans' medical records for vaccine and autism research. The effort has drawn criticism from some public health leaders who questions its legality, scientific value, and implications for patient privacy. Kennedy said the records are key to investigating the cause of autism and vaccine safety and, of course, chronic disease.
Good for Bobby Kennedy for seeking these records, de-identified, of course. This is not about surveillance. This is about really finding what are somewhat, not everyday conditions and trying to essentially get around the scientific establishments that have done a really poor job of figuring out what's causing the chronic disease epidemic. So he says that they have a pipeline of studies that they want to do in the next year, which is fantastic.
Absolutely. FDA misses deadline to ban electric shock devices for children with autism. So electric shock devices are used to punish self-injurious or aggressive behavior in disabled adults and children, including those with autism. The controversial practice, condemned by the United Nations as a form of torture, is now used by only the Judge Rotenberg Educational Center. This center is based in Massachusetts and operates 50 residents.
This is terrible. Apparently, the Massachusetts Supreme Court upheld the continued use of electroshock therapy in 2023. When I read this, Polly, it's like, teach these kids letterboarding. These kids can't communicate. Of course, they're going to have behavioral issues. Nobody knows what they're thinking and what they want. They need to be able to communicate. And then the issues, the behavioral issues that I imagine are real, are serious, they're going to really diminish. But it's just outrageous to think that they're using electroshock. They have wires on these kids, Polly. They have like a device in their backpack, so that one child they describe in this article was tased, essentially tased, over 30 times in one day. I mean, it's just horrifying.
And most of these kids are in pain. We know that autism or vaccine injury has a medical component to it, with gut issues and pounding heads and all
course.
those kind of things. And so they can't, like you say, talk. So they make noises and they get electric shocked on top of that.
It's horrifying, Polly. It is torture. That's one thing where the UN got it right. That's torture for somebody who's already in pain, for somebody who can't communicate, for somebody who may be jumping up and down or making strange sounds, or maybe even trying to escape or whatever. I mean, the right answer is clearly not torture.
No, and Billy used to
There.
bash his head against walls and stuff because he was in
course.
so much
So
pain.
it's pain, exactly.
Imagine being electric. Anyway, okay, it's disgusting. I don't know. Is there anything we can all do about it? We should.
I think, Polly, we should reach out to our friends in Massachusetts. We should do more about this. It's terrible. Well, I guess so. The issue is the FDA missed the deadline to ban electric shock. We could certainly put in FOIA requests about this. We could certainly write a letter to the FDA asking them to ban it. I mean, it should never be used, especially on children. Let's talk about that.
Yeah, please. Okay, Michael Nevadakis here. Pediatricians received little training on vaccine injuries, doctors report. Medical school students received little, if any, training on vaccines and vaccine-related adverse events and how to treat vaccine injuries. Well, we know this. We covered this in VAX 2. So if you want, there's a whole section in there on doctors not having any training at all. It's free. It's in the movie section of CHD TV. Go find it. It's The People's Truth. And you will see a whole section on exactly this.
Yeah, what's interesting in this article, Polly, that Michael Neverdakis did, is that 80% of medical students and 80% of the faculty all agree they don't get enough training on vaccines. So 80-20 that means that there's receptivity to making this more a part of medical school curriculums. And Kennedy has said that nutrition has to be part of the curriculum. Maybe, again, there's something that we could be doing to say you've got to, force medical schools, if these doctors are going to give vaccines, they need more training and they want it.
Yeah, and they should at least be able to read an insert and see what it is that's in it, because I think those medical students will be horrified. Brenda Belletti in The Defender. Woman confined to wheelchair settles with Merck over HPV vaccine lawsuit. The California woman who sued Merck in 2016, allegedly she was disabled by the company's Gardasil HPV vaccine, has settled this case. This is Jennifer Roby's lawyers asked Los Angeles Superior Court Judge Elaine Liu to permanently dismiss the case. Children's Health Defense CEO Mary Holland said Roby's trial made an important contribution to public knowledge about the vaccine's dangers and Merck's actions.
There was a settlement. The terms of it are confidential. A lot of information about Merck's bad behavior and the horrific side effects of the Gardasil shot came out. Candidly, it didn't go as far as I would have loved to see it go, but it made pretty clear that hundreds of teenagers were injured. Jennifer Roby got her shots as a 16-year-old in 2010 and 2011. She is permanently in a wheelchair. And kudos to her deceased first lawyer, Saul Agelat, who took the case out of the Vaccine Injury Compensation Program and put it into state court in California. There's more to be done in this space for sure, but overall, this was this is a step in the right direction.
And which reminds me of the Ron Johnson hearing just recently. the lady that was talking about having cervical cancer, how important the HPV Gardasil, and Senator Ron Johnson came straight back talking about Christina Tarswell.
Marcel, he did. And
Yes, and it was
that was great. And Emily, as you know, testified together with you in the hearing on Voices of the Vaccine Injured. Yeah, Christina Tarsell died early on in the Gardasil rollout. I think she was an early one of the people who died. And, the CDC didn't investigate. Pfizer has done nothing good about it. They're trying, as we talked about last week, to now do clinical trials in 4 to 8-year-olds. It's horrible, Polly. That vaccine does nothing that's provably positive and lots of things that are provably horrific.
Architect of Disinformation Dozen praises disinformation researchers for new laws targeting online speech. Imran Ahmed, CEO of the Centre for Countering Digital Hate, last month told attendees of the Cambridge Disinformation Summit that disinformation researchers deserve the credit for recent regulations of judicial verdicts targeting social media platforms. He also criticized legal attacks on himself and others, alleging they create a chilling effect on disinformation researchers and their work. There's a lot of disinformations in there, Mary.
Yeah, this guy is up to no good. The Center for Countering Digital Hate wrote, the Disinformation Dozen that got to President Biden and his spokesperson. They were definitely playing a huge role in deplatforming Children's Health Defense from all kinds of platforms. They've been behind the EU Digital Services Act, the UK Online Safety Act. I interviewed a woman, Sonia Elijah, last week, Polly, from the UK, who told me that 30 people are being arrested for content they post on social media every day in the UK. That's how serious this censorship is. This fellow, it's rich that he should be saying that there's a chilling effect in seeking to deport him. He is a total government control censorship advocate, and we need to be very clear about that.
Absolutely. Michael Nevadakis, Florida sues OpenAI, citing serious risks to children. Will lawsuits lead to more censorship? This is a lawsuit filed on Monday. Florida's Attorney General accused OpenAI and its ChatGPT platform of concealing risks while giving teenagers advice on how to commit suicide and providing instructions on how to plan mass shootings and other crimes. Experts agreed on the need to protect children, but warned that lawsuits could lead to greater censorship. God, that's just awful, Mary. I can't make this stuff up today. What's going on?
No, you can't make this stuff up today. So it is awful. You read this article about how ChatGPT aided a kid in, how to have a beautiful suicide. I mean, horrific stuff. And aided kids in figuring out how to have a mass shooting and be notorious. So horrific stuff. However, our people in our community, Sayer G, Greg Glazer, Scott McCullough, are all being very cautious, saying, this is really about who's going to be the censor. Is it going to be the state, Florida, or is it going to be the federal government? And we have to be very, very cautious about these narratives of the government creating safety for us. That's what happened with COVID. Ultimately, Polly, parents not only have opportunities, but they also have responsibilities, right? I mean, I don't know. I'm not sure exactly what the right solution is here, but I do think we know that censorship is not the right solution. Whether, there are certain affirmations that somebody is over a certain age, whether there are certain things that should not be possible because they abet crimes. Those are serious concerns. We don't want what a lot of industry wants, Polly, is that we can't get onto the internet without putting in our identification. And then everything we do is tracked, and there is no such thing as privacy. I mean, we're arriving at that point very quickly, but this would hasten it.
Okay, Jill Erzin, toxic plastics causing silent epidemic of kids with lower IQs, pediatrician tells Robert F. Kennedy Jr. So this is Dr. Leo Trezand, a leading pediatric environmental health expert. He warned on the Secretary Kennedy podcast that endocrine disrupting chemicals in plastic affect health from cradle to grave. He linked exposure to premature births, impaired brain development, and lower IQs. The interview came as HHS launched a $144 million initiative to measure and eventually remove microplastics from the human body.
So this is great. This is Secretary Kennedy interviewing Trisandi on his podcast. Kennedy made a parallel to these microplastics to lead exposure. We used to have lead in gasoline everywhere in the country, and it was causing brain damage and causing lower IQs. And there's very, very well supported scientific evidence of that. And this is the same thing. It's a silent epidemic. And as Trisandi says here, prevention is the cure, right? We've got to lower, and there's some good advice in the podcast, like, don't use so much plastic and wrapping, never put a plastic thing in a microwave, don't handle the receipts that you get that use bisphenol B, all of it. There's a lot of things you can do to reduce your exposure now to endocrine disruptors.
US Right to Know here, widely used pesticides linked to preterm birth defects and male infertility. Again, more about these things are routinely found in urine, breast milk, placental tissues, and infant cord blood. So again, warning again about the pesticides.
Right. So it turns out that neonicotinoids are the most widely used insecticides. And of course, children are the most susceptible because they are still growing. And so the exposure is much greater compared to their body size. And of course, what they say is, originally they thought, oh, this is only going to harm insects. It's not going to harm mammals. Yeah, right. No, of course, it binds to mammal receptors too. And so it's affecting reproduction, endocrine disruption, fertility, breast cancer, liver cancer, diabetes, and many more. So, we live in a toxic soup. And as Patty Lemmer in the book that we published, Toxic Total Load, we live in a really toxic world. And we really do have to have strategies that, avoid that. So we don't use Roundup on our lawns, and we don't cook foods in the microwave in plastic, and we don't buy bottled water that has plastic toxicity. Those are things that we can do that really do make a difference in the bigger picture, because we are in a very toxic world.
No, we really truly are. Okay, well, June the 9th, let's talk about that, Mary. If anyone's in our area, because I'll be with you then.
Yes, I'm so excited, Polly. We are going to be speaking together. You are in the spotlight on Tuesday, June 9th in Westwood, New Jersey, Northern New Jersey at the Elks Lodge. Please come join us. It's going to be super fun. We're going to be together in person, and we're going to be talking about your journey and all of the amazing work that you've been doing.
Well, and that's lovely. And also with questions, though, from people as well. It'd be lovely.
Absolutely. Absolutely. It's a great time to ask Polly questions, and also just to meet and greet. There will be an opportunity to chat with people. So please come. There's room. You have to sign up, or you can show up at the door, but even better if you can sign up. And we really look forward to seeing you.
And then the next day is the 10th, and this is Children's Health Defense in Washington, D.C. for a day. A lot of Children's Health Defense staff going to be there, lots of familiar faces. You're going to see Michael Caine, Stephanie Lucrucio, amongst many, many others. I can't think of them all, but there's a lot of people going. Of course, Mary's going to be there. So there's an advocacy special day, and then in the evening we have a screening of Duty to Disobey. So that would, be very exciting. It's our latest Duty to Disobey film. But if you can't make that, do not worry. We've still got the 30th of June. It's 3 weeks until the screenings now. We've got over 100 screenings have been confirmed in America. But still do get those tickets, because we want to pack those theatres out. And just go to dutytodisobeyfilms.com. And again, scattered around, lots of military members from our military chapter are going to be at this event. So they need support, so I'll go support them. And of course, lots of Children's Health Defense people around the country are going to be there as well.
It's going to be amazing.
It's going to be amazing.
Yeah, it's going to be June 10th on Capitol Hill is going to be very special. Again, you can sign up for that on CHD's first ever Capitol Hill Advocacy Day. I'm sure not to be the last, but this is going to be exciting with Senators Ron Johnson, with Senator Rand Paul, with Representative Paul Gosar, and then a lot of CHD folk and people from around the country. And we're going to go chat with our representatives and tell them what we're thinking about and what we think is important.
Yeah, it's going to be a big email presence as well there on the day.
Yeah, I mean, their job is to represent us. And so we do have a responsibility to go and make sure they know what we care about.
All right, everybody. Well, pray big, stand firm, never settle. Mary and I will be back next Sunday, but very exciting week ahead. So I think the news will be a lot more positive next Sunday.
I think you're right.
Bye, everyone.
Bye-bye.
In its simplest form, geoengineering is the deliberate manipulation of Earth's climate using technology. Solar radiation management is one form of geoengineering where they aim to block the sun. The acronym for this is SRM. SRM is a form of SAI, which stands for stratospheric aerosol injection.
All the terminology can get a little confusing, so bear with me.
Stratospheric aerosol injection is a geoengineering method to cool the planet where tiny reflective particles are sprayed into the stratosphere to reflect sunlight back into space.
Wait,
Ugly tech fix.
you could spray something into the atmosphere to change. Okay,
Spray
okay.
pollution into the atmosphere to stop it warming.
So in the end, pollution saved them all.
This here is David Keith.
David Keith is a geoengineer out of Harvard University whose program is funded by tech billionaire turned planetary health expert Bill Gates.
David Keith runs a scientific research group called SCOPEX, which stands for the Stratospheric Controlled Perturbation Experiment, as in perturbing.
It's an engineering project that would literally touch every living thing on the planet. People are terrified about talking about this because they're scared that it will prevent us cutting emissions.
Right, and also that it's sulfuric acid.
On June 30th, the White House released a congressionally mandated report requesting the study of 5 technologies, and they're focusing on reducing or eliminating natural sunlight from reaching the Earth. It's a very long title.
A long title it was, and in it they discuss spraying our stratosphere with sulfur dioxide from the back of airplanes, genetically modifying plants to reflect more light, and even spraying the ice at our poles with reflective material.
If we were to reflect sunlight to cool the Earth 1 degree, it would take 175,000 jet flights per year just to maintain that level. And you look at the amount of CO2 from the burning of the fossil jet fuel, and I think we begin to see the irony of the technology.
SAI not only didn't address CO2 reduction at all, geoengineers even warned about what's called the termination effect, meaning once we start, we can't stop without risking sudden and catastrophic heating, worse than the initial warming we started with.
So when someone says to me, why do I need to see this documentary? Why do I have to do it? It's not my thing. What would your answer to that be?
This is a documentary for everyone. This is a documentary for anyone who lives on planet Earth. And specifically, the way that I created this film was I was certain to create it in a way that could play the bridge, that speaks to the average everyday citizen who possibly doesn't believe in these programs, just like I had no idea.
Growing up in Northern California, the great outdoors was my first movie set.
Ariana.
I had a camcorder pointed on our natural world for as long as I can remember. From an early age, my mom taught me to see the magic in our forests, especially our trees.
You have the fairy house.
There was so much the trees could teach us, but instead of learning from nature, I did what Americans do best, paid tens of thousands of dollars and went to college. After film school, I moved to LA, where seasons don't really exist. The only green you ever see is your matcha, and climate change is just a thing you scroll past on the way to a meme, or at best it became a Halloween costume. Elon Musk was busy with Mars living out an Elysium fantasy. Some guy had already proposed to his AI girlfriend.
It was a beautiful and unexpected moment.
And Mark Zuckerberg was somehow becoming hot. All the while, our climate was unraveling faster than the RV mirror I once tried to fix with painter's tape.
2 girls on a road trip. 2 girls, 1 RV. 1 roll of tape. So dumb.
I was not a geoengineering activist. I was not someone who was trying to spread awareness. I was just an average girl who was freshly out of film school and knew nothing about this. And so I like to believe that this film really speaks to the average everyday citizen who, quite frankly, doesn't care. And so because of that, I thought, we need to make this documentary actually fun and entertaining and digestible and not stoke so much fear. Because I think people stay away from these topics because, quite frankly, we live in a world of disrupted nervous systems. There's so much fear coming at us through the media, and people are just left in this perpetual state of anger and anxiety. And the last thing I wanted to do was create more of that. So I tried my best to really kind of take them along like a palatable journey that would inspire hope if they make it to the end of the film. And so I'm really grateful that you guys had me on today and can be helping to share this message. And I think, the Children's Health Defense audience very much is aware of these topics, but my goal is that this film plays the bridge for everyone who doesn't already know about it.
Now, where can we see this film and how soon can we see it?
Right. So right now we're actually in the festival circuit on very exciting news. It just won Best Feature Documentary at the Santa Monica International Film Festival, which premiered here in LA of all places at the Directors Guild Theater. That was a historical moment to see the chemtrail movie receive such recognition. So very grateful for that. It's going to be released online in August. I don't have the exact date yet, but if you go to justlookupfilm.com and you enter your email, I'll be sure to keep you notified as it does get released online. You can follow along on Instagram as well. It's justlookupofficial. And then my personal Instagram account does post some stuff as well sometimes, and that's Ariana Victor Film. So yeah, very excited.
Well, we're very proud of you, Ariana. Thank you so much for coming on and talking to us about it. And please do come back and keep us updated because I can't wait to see this film.
Absolutely. Yeah, I'd be happy to come on again, Polly. It was great speaking with you today.
Tell us your names, please.
Wayne Lunsford.
And
Mary Lunsford.
okay, and this is about your dad.
Correct.
Okay, let's go back to which year did this happen?
This happened in 2021, August of 2021. So.
Had your dad taken the COVID shots?
He had not.
None of them.
He had taken no COVID shots. No COVID shots. For my dad.
Why not?
He was opposed to. He was doing some research, a lot of research, independent on his own about the mRNA, and he had an extensive amount of research on it, and was concerned about the lack of testing. What it actually is, gene therapy, essentially, and so he was real concerned about how that might affect him, or anybody for that matter, in the long run. So he was questioning it, like I think so many people were, and didn't want to take part in that. So he refused to take the shot, even though this was beginning to come as a mandate and through all streams of media, and he was just not interested in doing that. So
what led him then to end up in hospital? What was the lead up to that?
So in August, I guess the last week of August, he and I play music together and we're very close, and in August, no signs leading up to the last week in August. I think it was probably the August 23rd, if I remember, when he and my mom were checked in to the hospital. That same week, I came down. The three of us came down with it together, essentially. And
so your mom, your dad, and you.
Right.
And your dad didn't take the COVID shot?
He did not take. Right. He was not. I'm not going to call it a vaccine. He was not. He didn't take the COVID shot.
Did you?
I did not. And my mother was persuaded by her own doctor to go get this shot, and so she, under tremendous amount of pressure from her own doctor, decided to go ahead and do it. And so this was all while we were doing the research. Go ahead.
This is interesting. So now we've got a situation where The mother is vaccinated and in hospital with COVID. The father, your father, is unvaccinated in hospital with COVID. I'm just going to jump to the end right now.
Right.
Is your mum alive today?
She is.
And your dad is not?
Correct.
So,
Okay.
Can I jump in? Can I jump in?
Please.
So his mother, they both got the test and they were both positive. So they separated them immediately. They went to separate rooms. They couldn't, be together. They released her. They gave her, she had a UTI, uterine
Urinary tract infections, I think.
So they gave her the medication for that. And I don't think she may have had a fever when she went in, but they released her the next day and said, just go home and quarantine yourself for 10 days. And he was there.
They left him in?
They left him in. She could not go see him.
Different protocol?
Mm-hmm. They didn't give her any protocol, COVID protocol, but even though she tested positive, she just told her to go home.
So again, this is fascinating. 2 people, one vaccinated, one unvaccinated. This is really important because we're hearing this over and over again.
Right.
The unvaccinated person goes into remdesivir treatment, whatever you're about to tell me, I don't know.
Yes.
The other one gets some antibiotics and sent home.
Yes.
Unbelievable.
They treated her with, so that's what was really bizarre about the whole circumstance. The 3 of us come down with the same, and I lost taste, sense of smell, all the classic symptoms that everybody's mentioned. I'm sure probably everybody in here. And I stayed home sick for a week with the fever, and then they admitted themselves together, walked into the hospital, admitted her into her room. They immediately had the COVID test. They treated her for urinary tract infection with potassium and a few things, and I guess saline, some simple stuff, and released her the next day, within a day or 2.
Were they together in the same ward?
They were.
I'm not sure. I think he was on.
They were initially moved them to the same ward, the same floor of the hospital. He did not go to ICU for the first week he was there. But they released her. They began the protocol treatment with him with the remdesivir and a cocktail of other things that I can't pronounce. So
your dad, she goes home. Your dad gets put on remdesivir.
Day one. They gave him the first dose.
Right.
Day
But
one.
Not your mum.
No. They treated her.
But they both got tested with COVID.
Separate protocols. Right. It's completely separate treatments. So she goes in with basically the same symptoms with the same symptoms, has a fever, ill, stomach ache, all of the same symptoms, and she gets ushered one way and he gets another separate protocol altogether. So they treated her for UTI and let her go, just discharged from the hospital within a day or 2. And with him, it was an immediate separate treatment protocol which started with remdesivir day one.
Day one, yeah.
So,
but then they alternated. They skipped a day.
So
I think that's probably
what he got there.
Mm-hmm.
Yeah,
I can't pronounce it, but some of it.
Well, I probably won't be able to either. But
and I self-treated, so I went and
And you didn't go to the hospital?
I didn't know. No, I didn't.
He's not allowed. He's not allowed to go to the hospital. I'm trying to see what day one, 8/23.
No, their symptoms.
That's
Their
the
symptoms
remdesivir
were a
care.
little more. Their symptoms were a little more severe.
Right, so this is day one. This is day one, right?
Mm-hmm.
Okay, he's on a. They put him on a.
Oh, here it is again. Sorry, 8/23 again. Was it twice in one day?
They put
Is
him
that
on
the
a
same?
lot of,
Yeah.
Well, guys, I mean, I don't know if anyone can read this, but there's only no private information on here. But look, this is just day one. Guys.
Yeah, this is just day one, and he was there.
I don't know what these things are. Atorvastatin.
I don't.
I presume.
Some of them.
Dexamethasone.
Dexamethasone. Yeah.
That's a bad one. I don't.
Guys, you can see this.
I'm a nurse.
Okay,
Oh.
good. You can
Oh,
see-
okay. Well, maybe you can help us through this because we've been trying
Did they vent him almost straight away because this
No, we had a video call, the whole family
is
together.
venipuncture.
stick.
IV.
Okay, so they're
Draw
charging.
blood.
Look how much money they're making out of your dad on day one. I know this sounds awful because you don't want to be hearing this, but
I
they're
already
making
knew.
some serious money out of him. Straight away, look, guys. This
So
is
the other troubling thing was, I texted him. I didn't have these records. It was his sister that had them. And I texted him and said, what medicine are they giving you? And he texted me back, and he said, they're giving me ivermectin, because we had the conversations before he even went to the hospital. Oh, we need to make sure we have ivermectin or can access it. I'd already done the research. I knew Florida was handing it out, hydrochloroquine, and Texas were doing some of those studies. So he was confused. He thought he was getting ivermectin, and he wasn't.
okay. He's getting a lot of remdesivir and a lot of other stuff, but maybe our viewers will understand. And certainly the nurse behind me does. This is still day one, I think.
So he was there till September 11th. That's how many? Is that 2
So
weeks?
what-
19 days.
So what happened? So talk us through what happened. I just want to just show because there's an awful lot of money being made out here, and
Yeah.
a lot. Yes.
I mean, they wouldn't let anyone visit him, so we don't really know what was occurring on a daily. Only what he told you.
Right. So we after he began this, he started the treatments, and we realized that he was going to be there for a while. We started sharing texts back and forth. He was explaining what he was complaining about the food. He was feeling well. His spirits were high. He was feeling well, and but I could tell from we were FaceTiming. So the hospital was really good about, let's schedule a FaceTime in the afternoon, and we did this every other day, and we're constantly. He had his phone, and we were able to communicate through text. Back and forth, and his spirits were fine. He did not. We were having the conversation up here. I don't remember them ever. So a few of these testimonials were that they asked the family about ventilator, as if, I don't know. They put the question to the family: is it okay to ventilate? I guess that depends on power of attorney and what what the family's concerns are about that. But he, I guess he would have consented to that on his own, maybe.
No, we did no.
But we did have the conversation within the first couple of FaceTimes.
We denied the ventilator option.
And
we said
absolutely
not.
Yeah, that we didn't want to do that. We voiced that to him through FaceTime as well, that we disagreed with that. We didn't think that that would be a good idea. And I know that later conversations toward the last week or so, I guess, of his life, I remember a conversation that I had with him. His doctor told him, he said, if we put you on a ventilator, it's your chances are. He didn't put it that way, but he said, your chances of surviving, or anyone's chances of surviving once they go on a ventilator, is like 15%, between 5 and 15%, maybe, something like that. But the message was that it didn't look good once they make the decision to put you on a ventilator. That's pretty much. So he and I had conversations that my mother was already home and having different conversations, and I'm sure the conversations they had between each other were not conversations he and I had about how he maybe would want to protect our feelings and they whatever conversations between them. But I could tell from discussions and what he was saying through his texts that he realized that he was not leaving that hospital. And it could have been his conversations with the doctor. Your lungs are cooked. We're not going to tell you that it was the protocol, but your lungs are cooked and you're not going to. So he basically, and without saying that, had reached the conclusion that he was not leaving the hospital. That he's combination of the protocol. Or we don't know. My theory is that it was probably both.
I think a lot of it is in
the sickness
here, to be honest.
and
so we kept getting confusing messages. Like one day he was like, oh, he's eating breakfast, he's up and he was talking the whole time to us. So we felt like he was getting better. And the day that he got killed, we had sent a letter to the hospital because I had been doing all this research, and I was like, you know, what's the fastest thing we can get to him to maybe help him? And I had researched budesonide, the inhaler that they give to babies that have pneumonia or conditions. I was like, maybe we can get the doctor to order this and have him just breathe on it, because he had the, you know, the oxygen mask, whatever. So I typed a letter, it's probably in that packet, and I sent it, we faxed it to the nurses station saying that if they can order this and give it to him today, it might help, because I had done the research, and Georgia has the law where it's a right to try something. Why don't we try something else? Yes.
Can I put this up?
So we faxed that day from my sister-in-law's house, and we called later that evening to make sure they had gotten it, and they did order it. It's on the records where they had ordered the.
They had ordered the budesonide
yes.
nebulizer.
And he called them when we got home from a family event, and you talked to the nurse.
I did. By this point, I'm like, well, forget a protocol that is completely new, using a treatment that nobody knows about, has never been tested. Let's treat this. Can we treat this as pneumonia? We have a family doc. We have a friend who is a doctor, and I called and asked him about would a pulmonologist consider a recommendation from a family member to a treatment that is not part of this protocol. So why my thought was, why don't we treat this like pneumonia? If you know, pneumonia is treatable in a hospital, and people are treated for it and survive it all the time, and budesonide is given to infants who have undeveloped lungs, and they, you know, it's standard practice, I think, from the reading I've been doing on it. And so we asked for that, and the doctor okayed it, and I guess that was in the document there. Mm-hmm. He said, yeah, we'll try it, and again, by then I think his fate was sealed already.
What is HCICU General is everywhere over here at 6,236? You know what that is?
That's probably just a daily ICU charge, I would guess.
Oh, wow.
Oh, yeah.
The total charge amount of money is 183,000.
That's right.
But that's actually not that. We've had way higher.
Oh,
than
sure.
So
Yeah,
he wasn't worth that much, really, compared to some of these other people we've had on here. But it's the whole thing is fishy. It's dodgy.
Oh.
It stinks.
Yeah.
So the day that we ordered the budesonide, he was on the phone with the nurse, just making sure they got the fax, and she had said something about, well, we gave him morphine, and we never okayed that.
Right. So
we didn't give the permission to give that. So I think they gave him the morphine because they didn't want the budesonide to help him.
Well, we had a conversation with John Drummond about that, because he and I were exchanging some texts in the day or two leading up to September 11th, and so I asked John, because he said that they were talking about morphine.
I don't know who John is.
Right. Well, that's fine. That's so doctor friend, and he said he was saying that if they give him morphine, he probably won't survive more than an hour or two if they do that. So I wasn't sure why they were going to give him morphine, other than they wanted it to be.
I think they knew that we knew that it was all wrong. I think they knew, and they just had to complete the.
Mm-hmm.
Right.
Because I had mentioned ivermectin already in the very early stages.
Did you get to be with him in his last month?
No, they weren't allowed visitors at all. No.
That's really sad.
And 19 days, which was, at different hospitals have different rules on visitation, I think. So
yeah, we called Emory, and they're like, "Oh, it's only 10 days," but Piedmont's 14.
What was the last thing your dad said to you, by text, or did you speak to him?
I spoke to him the Friday before. He passed on a Saturday. I think September 11th. That year was on a Saturday. So I spoke to him Friday, it was obvious to both of us. He said a couple things I don't want to share, but we both realized that this would probably be our last conversation. It was strange, and I think he knew about the morphine, even though I don't think it's anywhere on any of this
They didn't put it on the
paperwork
chart.
here, because of conversations he had. And when we asked about the budesonide, I think it was that Saturday. So the last the last call I had with him was Friday before, and on Saturday they gave they okayed the budesonide. And I was trying to ask you about the call that we had after that. We called the hospital, and
You just called to check.
I
make
called
sure
to check
they
on
got
the.
the
I
facts.
got right. I called to check to make sure they got the facts on the budesonide,
And
they did answer the phone. The nurse's station answered the phone, and at that point, it was chaos in the background. So it was very bizarre. The chaos was in the background. I was on the phone with the nurse, and I told her, if you give, and I'd had this conversation with a family friend who's also a retired doctor, and and I said, well, if you give him the morphine, they said, we're giving him morphine. We're taking him to administer to give some morphine, and I asked them not to do that. I said, if you give him that, he won't survive an hour or two at best.
And she hung up on you.
And yeah, there was chaos in the background I could hear, and then she hung up. Hung the phone up, and that was an hour or two later. My mother called me and said she had gotten a call from the hospital that he had passed, and all of this was within a matter of a couple of hours.
Awful.
So yeah, it was.
And we had just had a family dinner, and we were all like cheering because we were like, "Oh my gosh, they're gonna actually honor our request to try a new."
Well, we thought
medication.
the budesonide would work for him like it does for millions of other people who've been treated.
So we were like, yelling in the kitchen, like, "Oh my gosh, he might actually come home."
Yeah. So it was kind of a roller coaster ride the last few hours. We were feeling really positive that.
And suddenly shock.
And he was fine. I mean, it's not like he had just given up. We had a conversation earlier in the afternoon.
2 weeks. I mean,
early in the afternoon, he had lunch. He was getting up. He was going to the bathroom. I mean, his oxygen levels, it's all the same story. Oxygen's at 85%. We can't, the first couple of days he was in there, he was, no, doctor, I want to leave. I'm not on board with any of this to begin with. And his doctor talked him out of it. Said, you're going to have a heart attack, and within within 24 hours, if you get up and leave, your blood oxygen's so low, you're going to go into cardiac arrest, and you won't survive. So they did everything they could to keep him there, and would not let him leave, and would not let anyone see him. And so
What was on his death certificate? What did he
pulmonary, acute pulmonary something or other failure.
Was COVID on there?
I didn't see it.
Oh yeah. They gave it another name, but yeah. Essentially that.
We'll just say we are learning on this tour about this.
Okay.
And the one thing is for sure the unvaccinated are treated different from the vaccinated.
Sure.
The amount of money we're being shown that is made out of these what we call victims. Something is very dark here.
Yes.
Yeah. Without a doubt.
Can I show everybody a picture of this?
Sure.
Yes.
We're going to put him on the bus, guys, of course. But
Charles.
I don't know what
His name is Charles.
Charles. I don't know what you viewers think, but there seems to be an awful lot of the same age group, the same kind of look. I'm sure it's a coincidence, but look at the pictures of all these men. They could be brothers, right?
Yes.
I mean, maybe that's a coincidence. Anyway, look at him, you handsome man, your dad. We're going to put him on the bus. Now, what else do you want to say to the viewers about this tragic story? She's more outspoken, viewers, than this. This is a little more cautious.
Well,
put
I've
the
been
mic on her.
I've been doing a lot of research, since all this started coming out. But there is I don't know if you've heard of a lawsuit going on in Wisconsin right now about a father that lost his Down syndrome daughter to the same protocol, Amazing Grace. So he's got his trial coming up in November. So I'm really, really praying that it does go to where it needs to go, and the world can know what is going on.
That's right.
Because I think we can't back down.
No,
we can't give up.
And you're all saying the same thing.
What shots?
It's all about the money. I will never step foot in Piedmont Hospital again. Piedmont, if you're listening, I will never. And if I can get on some kind of I don't want the money. It's not about the money. For me, they need to understand what they've done, and maybe they don't. Maybe the doctors still don't know. But how could they not? How could they not know?
I don't think that's the case.
How can they live with their heart?
I find it difficult to believe, and I'll just say this, that the entire medical community, well, not the entire medical community, because there is a small group of people, of doctors and researchers that are questioning all of this, but it amazes me that one of the leading pulmonologists in the state would not question a treatment protocol and refer back to years of experience and knowledge about how to treat.
I just want to save a life.
Illness,
You're saving someone's family member.
So abandoning and all. So if the medical community is abandoned, they just throw. Getting rid of informed consent. You got to take this treatment, or else.
Or you lose your job.
So it surprises me that the vast majority of the medical community is throwing everything they know out the window to latch onto this treatment and without questioning it. And the only thing I can think of is the same thing you hear. We don't want to lose our job. We don't want to lose 2 times private school and my wife and 4 cars and the $1 million house. We don't want to lose any of that. And that's a difficult thing to face, when you. But
well, not when
that's
dying.
Exactly. So it's exactly. So the question is why? Is it? It's a patient. I had lots of patients. If I'm a doctor, you lose patients all the time. People die, and so to be such a widespread abandonment of.
Well, we'll get to the bottom of it.
Anyway, I could ramble on about my theories there, but it shocks me honestly that.
We're just going to end on one last question because we've gone way over time here.
Yeah.
How is your mum doing today?
She's fine, doing well, doing right. We're doing well. We see her all the time.